Today, we're going to be looking at this paper that looks at COVID reinfections, looking at first infection, second infection, third infection, and then the development of any sequelae. So in this case, we're just looking at post-acute sequelae as a morbidity complication, a health complication that occurs after the infection. This is not going to be a study that looks at long COVID. It's specifically looking at adverse health outcomes after a COVID infection, looking at people that have had one infection, two infection, three infection, and then predominantly looking at what are the chances of having adverse health outcomes in these different categories after one, two, and three infections. So, how do they run this analysis? Well, what the authors did is they sort of did a retrospective study where they went through and looked at the US Department of Veteran Affairs National Healthcare Database to build three cohorts of people. Essentially, they had a cohort of people that have one documented COVID infection, a cohort of people that had no COVID infection, and then a cohort of people that have had reinfection. So this would be two or more infections. And these are pretty large sample sizes. So what you're able to do with this is look at health outcomes, adverse health outcomes in people that have never had COVID infections. This would just be the natural health outcomes that would occur in the population compared to people that have had a COVID infection and then more than one COVID infection to see if they have worse health outcomes after contracting the virus and then after contracting the virus multiple times. And what they found is that compared to having no COVID reinfection, getting the virus multiple times contributed to additional risks of death, of hospitalization, of getting other health issues like lung issues, heart issues, blood issues, diabetes, gastrointestinal symptoms, kidney issues, mental health issues, and musculoskeletal and neurologic issues. And additionally, compared to non infected controls, the cumulative risk burdens increased. So if you have a person that's never been infected with COVID and a person that's been infected with COVID, the person that's been infected with COVID is going to have worse health outcomes than the person that never was infected. But then with each subsequent infection, you're getting worse and worse health outcomes compared to the just having less reinfections, and then also compared to the people that have never had COVID in the first place. Where the authors conclude that to reduce the overall burden of death and disease due to COVID as a result of COVID infection and reinfections, it'll require strategies to prevent reinfections in the first place. So this is going to be things like cleaning the air, wearing masks, making testing available to everyone, making healthcare affordable and available to everyone, making vaccines available to everyone at more frequent times throughout the year, all of these types of things. Now, one thing to note is that this is sort of top heavy in terms of the COVID number of infections. So people that had only one documented COVID infection made up the majority of this cohort. There was about 443,000 people that make up that group. And then there's about 41,000 that make up multiple reinfections. And of those, about 38,000 had two documented infections. And then about 2,500 had about three infections documented. And then about 378 people had four or more infections that were documented for COVID at that point. So it's more heavily weighted. But again, these are still very large sample sizes. Even at the smallest, 378 is still a lot of people to get statistical significance. So because of that, the first thing they did is they looked at people with one COVID infection and compared them to everyone else that had more than one COVID infection. And they looked at all of these different categories here, like what we talked about prior, the all-cause mortality, so death, hospitalization, and then having at least one sequela. So, and then having more specifically one of these issues here. So if there was no additional risk burden of people that have multiple COVID infections versus having just one COVID infection, we would expect this to be like a 1-to-1 ratio in terms of poor health outcomes, but we're not seeing that. We're seeing an elevated risk for having multiple COVID infections versus having only one COVID infection. And we're seeing the highest categories being hospitalization, so risk of hospitalization, cardiovascular health issues, blood health issues, so coagulation issues, too much clotting is usually what that is, having microthrombi develop into thrombi, giving you heart attacks, and then kidney issues, and then lung issues. Where for all of these, you're having about a 3 times greater risk than if you only have one COVID infection for when you have multiple COVID infections. Where the big takeaway from just this alone is that you want to prevent yourself from getting as many COVID infections as possible, because the longer you're able to push that off, the better your health outcomes will be going forward. And if you keep getting reinfected over and over again and you don't do anything about it, then you're going to have, like, this is a definitive thing, you're going to have worse health outcomes than you would have otherwise. Now, of note, the authors also looked at people that were vaccinated and unvaccinated and looked at the risk of reinfection, and they found that having a vaccine versus not having a vaccine did not mitigate the overall health risks of getting multiple COVID reinfections. So, does that mean vaccines aren't effective? Does that mean you shouldn't get them? Absolutely not. Because we have seen in tons and tons of data that it lowers your chance of hospitalization in the acute phase. So, it's very important for that. And then also, it lowers your risk of death. And then also, it reduces the risk of long COVID. But it doesn't mean that they're this sort of blanket shield that protects you from everything, because even if you're vaccinated, if you keep getting reinfected, you're still going to have these worse health outcomes than if you had never been infected with COVID in the first place. So again, they're breaking this down where they're looking at people with COVID infection, just one COVID infection, and then people with multiple COVID infections, so reinfections. The ratio would be 1-to-1 if there was no increased risk with reinfection. And then they're looking at people that have had no vaccination, one vaccination, and 2 or more vaccinations, and it does not seem to do anything to prevent the increased morbidity complications from getting multiple COVID reinfections. Following this, the authors looked at the time component. So acute infection would be this orange here in the first column, and then the blue is looking at multiple time points after the acute infection is over, so the post-acute period. And again, they're not looking at long COVID, they're just looking at adverse health outcomes following a COVID infection and a COVID reinfection. And what they're seeing here is that in the acute period, you have the highest risk of having bad health outcomes. And this is sort of attenuating over time. So we have the days down here. This is 60, 90, 120, 150, and 180 days for both of these. But the thing you need to know is that while it's high and then sort of going logarithmic and getting low, it's then plateauing. You can see this over multiple different categories, that the risk then remains elevated. So again, they're looking at this 1-to-1 ratio. So having people that have had reinfection versus no reinfection. So they're not looking at healthy controls in this. They're looking at one COVID infection versus multiple COVID infections. And the risk is remaining elevated for these health issues following the acute period of the infection itself. In the long term, it's sort of holding at an increased rate, at an increased level with these reinfections versus having no reinfections. And while I think everything we've covered to this point is very important, I think this right here is the most important figure in this paper. So this is looking at the cumulative risk burden from 1 infection to 2 infections to 3 infections. And again, these are at very large sample sizes, and it's 3 or more. So they're grouping the 3 and then the 4 plus together to give like about a 3,500 people unit. And we're seeing that with each of these groups, the risk burden is increasing. So you're more likely to be hospitalized when you have a higher number of infections. You're more likely to have at least one post-acute complication from the COVID infection when you have more than one. When you have more than one, everything else increases, and this seems to hold true for each one of these categories. So you're more likely to have bad health outcomes the more COVID infections that you have. And importantly, so similar how they were doing the one COVID infection versus multiple COVID infections before to give a ratio, sort of like a hazard ratio. They're doing that here with the 1, 2, and then 3 or more infections versus non-infected people. So you would expect a 1-to-1 if the non-infected people that never had a COVID infection were similar rate of having bad health outcomes to the COVID infected and the COVID reinfected individuals. But we're seeing that that's not true, that it's increased for each one of these. So not only is it more impactful against the other reinfections, it's also more impactful versus not having an infection at all with COVID. And then to sort of ground this into context, back to the beginning, the aim of their analysis was to examine the health risks associated with people that have had multiple COVID infections versus no infection. So that was the point of this study. and their analysis should not be interpreted as an assessment of severity of infection. They didn't look at that. They didn't look at like mild, moderate, severe outcomes in each of these categories. They just looked at, do you have an increased risk of having a adverse health event if you have one COVID infection versus no COVID infections, or more than one COVID infection versus just one COVID infection, or more than one COVID infection versus no COVID infections. So that's sort of the grounding context of this analysis, where their conclusion, once more, to reiterate, is to prevent people from getting more than one COVID infection, because the more COVID infections you get, the worse health outcomes the population at large will have. And that should be, in their opinion, the goal of our current public health policy.